During these challenging times, behavioral health services, especially crisis services, are more important than ever. So I'm really excited to give you a quick tour of our 9,000 square foot facility. The Behavioral Health Urgent Care Center, which we call the BHUCC, is located in the City of Industry. It's just off the 60 Pomona Freeway, but will serve many people in crisis throughout the San Gabriel Valley. The facility is operated by Starview Behavioral Health on behalf of Los Angeles County Department of Mental Health. This center is meant to provide mental health consumers with intensive services needed when they're experiencing an escalation of symptoms to the point of a crisis. The principal goal of the BHUCC is to help consumers avoid hospitalization through stabilizing and returning to their homes. Continuing mental health services and other support services are arranged for those returning home to help assure ongoing stability. Some people liken the center to an urgent care center, almost like one they'd use for medical issues, but this is for mental health services. The total capacity of the BHUCC is 18 clients. Clients may stay up to 24 hours, and they'll be served by psychiatrists, nurse practitioners, therapists, case managers, peer counselors, and other specialists. For clients who are not able to stabilize within 24 hours and require hospitalization, transfer and transportation will be arranged. We also arrange for transportation home as needed for clients who have successfully stabilized. Let's go inside.
Those who come through these doors might come because they live with a mental health condition or they were referred by friends, family, or a community organization. We are available to anyone experiencing a psychiatric crisis who has a primary mental health diagnosis. Most of our clients will come through this entrance we call the Crisis Walk-In Center, or QUIC. This is the main entrance for voluntary clients, and it's open from 8 a.m. to 8 p.m. 365 days a year. Later, I will show you our second secured entrance for involuntary clients. The secured entrance can also be used by voluntary clients after hours when the QUIC is closed. Throughout our center, our overall objective is to treat patients with dignity and empower them in their recovery. We want to make their experience here safe and affirming. Part of keeping clients safe during the COVID outbreak includes temperature checks before they enter. We also supply masks and have the ability to space seating for social distancing. For everyone's safety, clients will also go through a metal detector upon entering the facility.
Part of the intake process takes place in the exam room, where the nursing staff provides a medical screening.
It's important that a client be medically cleared to be sure there are no underlying conditions that would make them unsafe in the facility. If the individual is admitted, a psychiatrist or psychiatric nurse practitioner will complete an assessment in person or via telehealth. They will develop a plan of care that may include services in the community or psychiatric hospitalizations. Those needing a higher level of care or psychiatric hospitalization will then be transitioned onto our secure units. Our mental health specialists will also conduct assessments to determine if the individual needs other services such as continued ongoing therapy, psychiatric care, case management services, and other services from a provider in the community. Those needing a higher level of care or psychiatric hospitalization would then be transitioned onto our secured units. Our mental health specialists will also conduct assessments to determine if the individual needs other services such as continued ongoing therapy, psychiatric care, case management services, and other services from a provider in the community.
Since we serve adolescents 13 to 17 and adults 18 and older, we have two separate units. This is the adult unit, which has the capacity to serve clients either voluntarily or involuntarily.
Voluntary clients will come through the QUIC and into this unit if they will need a longer period of time to stabilize during their psychiatric crisis. The mental health specialist will also do an assessment, providing therapeutic interventions, and they'll determine needed services and supports. Then a case manager or peer and family advocate will work with the client to link them to needed services and supports in the community. Here, clients can also relax in extra comfortable reclining chairs. There's also a kitchen where staff will heat up prepackaged meals or a snack for clients. The bathrooms on the secured units also have showers. If it is determined an individual will not stabilize within 24 hours, they will be transported by ambulance to a psychiatric hospital. Those who stabilize will be discharged, and transportation will be arranged to return them to their community. Those who stabilize during the night may be discharged but will remain on the unit until the next morning if needed. This is the privacy room where clients wanting greater privacy in a safe environment can stay. And here in the group room, groups of patients can process issues together led by a therapist. Also prior to discharge, a client may meet with treatment staff and family members here.
Our facility has two entrances, one for daytime entry through the QUIC, and this one at the rear for after hours, law enforcement, and other public safety responders. We call this rear entrance our secured entrance. After 8 p.m., voluntary clients can enter the BHUCC through this adult and adolescent secured entrance. Clients will be served on a voluntary basis or for clients meeting criteria for 5150 or 5585 hold on an involuntary basis. A member of our safety specialist team will meet them here.
Members of the safety specialist team provide a smooth transition into our facility at the rear secured entrance. Our safety specialists, as well as the rest of the BHUCC staff, are especially trained in de-escalation techniques through a certification program called PROACT. If necessary, our safety specialists and staff can de-escalate clients upon arrival. In addition to working with the clients, our safety specialists also patrol our site 24 hours a day.
The transition from law enforcement to our center is quick and simple. Prior to the existence of urgent care centers, it was not unusual for law enforcement to spend 4 to 6 hours of their shift driving and escorting a mental health patient at a hospital ER. But now they can bring them here and be back working in the community within a short time.
The Adolescent Unit has similar functions to the Adult Unit, but it's for teens ages 13 to 17. It has a capacity to serve 6 teens at a time, and this can be on a voluntary or involuntary basis. Young adults who are negotiating the passage from adolescence to adulthood face incredibly difficult challenges, including depression, anxiety, homelessness, and substance abuse. And we are here to meet them where they are.
Whether we're treating adolescents or adults, the BHUCC is here to provide crisis mental health services. We're helping to alleviate impacted hospital emergency rooms that are not always equipped to deal with some of these issues. We're happy we can provide this much needed service in LA County.